I'd like to say good day to everyone, and thank you for joining us on episode 177 of The Crisis Jam. I am not Laura Evans, but I am hoping that Ms. Laura will join us soon and will be your host for today, but I'll sit in and try to do my best to kind of cover it. We are so excited with today's Crisis Jam because we'll be presenting or have presented to us a Crisis Continuum and MCT services by Jess, Spohn, and she will be dynamic. I've already know about her, know about what's going on, so really looking forward to this presentation for today. As you are reminded each week, if you have not yet registered or know of someone who's not yet registered, please feel free to go into talk.crisisnow.com, go ahead and register for the Crisis Jam, and it will provide you with a wealth of resources that are at your disposal so that you're able to then make your connections and find out information. It's also extremely helpful. You can watch previous episodes of the Crisis Jam. You can look ahead at resource material and even see what's coming up next. Next slide, please. On the Crisis Jam so far, I've been updated that we've had nearly 500 unique speakers since 2020, but we are still in search of others. So if you have ideas or anything that you would like to see added to this Crisis Jam, please don't hesitate and place it into the chat box. You can see all of these names. There are constantly new ones being added to our listing. Now, some of the events that are coming up on this first event here, we're talking about Inspiring Hope 988 and taking a look at some of the elements that have come up in the Crisis Jam with the teams involved with that. Can we go to the next slide, please? This one is really one that touches me. The Georgia Behavioral Health had recently a event where they showed up at the Atlanta Braves game, and you see a number of really high officials there, one of which is the commissioner from Georgia, who actually not only came to the game, but threw out the first pitch. And what we've been discovering is that people who throw out first pitches, generally, whatever the measure is, really gets heard and really becomes a part of what our message is with 988. So it's just showing again the expansiveness and the necessity to really get the information out there so that people are aware of the existence of 988 and how important it is for all of us to embrace its usage. Next slide. In this slide, I'm going to ask if Heather, if you are available, if you would come on and just give us some information with regards to this National Crisis Continuum Conference. Heather, are you there?
I'm here. Thanks,
Great.
Brian.
Sure.
So good to see you all. My name is Heather Honecker. I'm the president of the Crisis Residential Association. We are so excited to be partnering with the International Council for Helpline to bring you all CrisisCon, the National Crisis Continuum Conference. This year's conference is taking place in Phoenix, Arizona, October 14th through 17th at the beautiful Arizona Grand Resort and Spa. I mean, it is beautiful, y'all. We are so excited to be there. We are still looking for presentations. Our portal is open through Friday, June 7th, midnight Eastern time. We would love to hear from you all. Any innovative practices you have or any ideas you'd like to share, please submit them, and we hope to see you in Phoenix this fall.
All righty. Well, thank you so much for that, and definitely looking forward to that upcoming event. And that's a reminder that it's in October. So please put it on your calendars. Let me go to the next slide, please. We want to let you know that the wonderful Crisis 3 Summit that is going to be held in Amsterdam coming up has been sold out. And this is really a phenomenal affair. So those of you who weren't able to get on board, you'll just have to talk to those who are going to be a part of it. But such a wonderful element. And a reminder that it is part of a two-phase element in the Netherlands. Initially, before that, we're going to have a GLE conference, but this particular conference is going to be June 29th and the 30th of 2024 in Amsterdam. and really looking forward to not only the agenda, but just people being a part of this. And at this point, I've been told that the host is now in the house. So without further ado, if it's okay, I would like to pass it on to my dear colleague, Laura Evans. Laura, are you there?
I am here. Thank you so much, Brian. And I was having some trouble joining, and so I did what you're not supposed to do here at Crisis Jam, which was use a colleague's link. So just a plug to make sure that you're signed up. But thank you, Brian. And again, just happy to be joined today, going through these news. So making sure that people do get the response that is needed, that is the complete goal of this crisis transformation, of leveraging 988 to make the crisis change that we need. And so I think this is a great article that really highlights that sometimes folks who may not be in the field could see something, well, police aren't showing up, and think that's a negative thing, when actually this is a really good, this is what we are hoping to move towards, that people can get the right intervention at the right time. So let's move forward, please. Thank you. And we've got our crisis trivia hot seat. I'm going to ask my colleague, Jess Spohn, to come on, because I believe you are in the hot seat today. Is that right?
I am. Hi, Laura.
Hi, Jess. Good to see you. So today's trivia question: how often is fire dispatched by 911 versus some other means? Talk us through, and this is part 3 for you. So I'm just going to thank you for doing the over under and joining for the hot seat. So this one's yours, Jess. Walk us through your thinking here.
Okay, so for this one, how often is fire dispatched by 911 versus some other means? When I'm thinking about fire getting dispatched, I would feel like more often it would be dispatched kind of by that PSAP, by 911. So I would guess to say, I don't know if anyone else has some answers for the over under, but I'm thinking that maybe fire is dispatched, I don't know, maybe like 30% of the time. I feel like 30 sounds like a good number.
Okay, I see Amanda Miller, our other vibrant colleague, saying 5%. We've got over, under. So folks are saying over 30% is how often fire is dispatched by 911 versus some other means of dispatch. Pretty solid. We see 10%, that would be under. 60, that's over. 90, over. So let's see what the actual answer is here. Way over, 89%. How does, any reaction to that, Jess?
Wow, I mean, that's an amazing number. That's so high. I said 30 and it's closer to 90. My goodness. I think I saw some people in the chat that said something about 90 or somewhere close to 90. So some people really were on point today.
Yes, so close. Yeah, so thank you. That's actually shocking for me as well. Okay, so let's see the next one. Over, under. How often is mobile crisis dispatched by 988 versus some other means? So again, this is when we're thinking about the total number of times that a mobile team is going out. How often are they going out because they have been dispatched by a 988 crisis contact center versus direct calling or some other ways. So it is solely about the number of times they're being dispatched, not about the number of calls that result in a dispatch. Sorry if that was confusing for everyone.
Okay, and I know that mobile crisis teams nationwide can be dispatched by a variety of ways, right? We've got 988, we've got our PSAPs and 911 systems. They can be dispatched, like self-dispatch or by, different agency types. So I'm gonna hope, right, that we've got, more accessibility to doing 988 dispatch. So I'm gonna say 50%, just to see.
Okay, so 50% of mobile crisis dispatch are dispatches from 988. Let's see, we've got lots of under, Jess. Are you're sticking with it?
I'll stick with it, even though I'm pretty sure it's under. But you know, I've got good expectations for our 988 team. Yep.
32%. 32%. Yep. Obviously, more connection between 988 crisis contact centers will be needed. But this is a mobile crisis practice dashboard. Dr. Goldman, who is a friend of the JAM, as well as Preston Looper, reported on this national survey mobile crisis team. Alongside you, Jess, do you want to give a quick comment, or if Preston, if you're here, do you want to jump in?
If Preston wants to jump in, I know this is their.
Yeah, happy to jump in. Hi, all. Way to go, Jess. That was pretty cool. You handled the heat well. Yeah, thanks for showing the best practice dashboard. What we looked at is various practices based on survey result, and just wanted to provide an initial snapshot because we're geeked out about dashboards and metrics and thought other people would be as well. And we're hopeful that this would be at least conceptually modeled for mobile crisis and a number of other types of services. Thanks.
Awesome. Preston, how can folks get a copy of that? Could you put that in the chat for us?
I will, and I'll pleased to say that SAMHSA has the National Mobile Crisis Survey on the Crisis TTAC site, and so I'll provide a direct link to the survey as well as the SAMHSA TTAC site.
Awesome. All right, Jess. So we're going to give you your third one. Golden hour, right? Golden hour in trauma care emphasizes the importance of timely response for life-threatening conditions. The chances of survival for out-of-hospital cardiac arrest decrease by 7 to 10% for each minute of delay in defibrillation. Which of the following impacts ambulance response time on average by 4.4 minutes? So are ambulances impacted by how quickly they can get to someone because of rainstorms, major marathon, local festivals, or road construction?
I can see where all of these would definitely cause a delay, especially depending on what part of the country you're in and, the infrastructure you have when there's, inclement weather, or people that are crossing the streets, which I would think both festivals and marathons would come across. I know right now, at least in my area, I don't know about y'all, but we've got some pretty intense construction. So is there a group consensus? I'm kind of leaning towards construction because that's the one that I'm the most familiar with. And I know they would have difficulty kind of navigating, like maybe the shoulder is closed or there's no other way to be able to get around the traffic that's caused by the construction.
Anyone you want to bring up before we go to final answer?
I will bring in my colleague Amanda and see if she has any thoughts. Amanda Miller.
Thank you, Jess. I would agree with you. I think road construction would cause the most impact here.
Okay, well, we've got 2 for road construction, a lot from the audience around construction that never ends. Let's see what the real answer is here. Marathons. Major marathons can cause significant traffic disruptions. These delays can be detrimental, particularly in heavily populated urban areas where EMS needs to navigate these roads quickly. So I'm sure we have lots of marathon runners here, but those marathons and those roads being closed does impact that ambulance response time by about 4.4 minutes. All right, well, we already have Jess and Amanda pinned up here. So I'm going to keep them here for our featured presentation on 988 and MCT connections. Amanda is the director of crisis continuum within Vibrant. And actually, Amanda, I won't call you up just yet. Let me just focus on you, Jess. And Jess is a program manager within Vibrant Emotional Health for mobile crisis teams. And we're so glad to have them within Vibrant. So Jess, let me turn it over to you.
Thank you so much. Thank you for the introduction. It's nice to see you all. What a wonderful turnout we have today. My name is Jess Spohn. My pronouns are they and them, and I'm the program manager in Vibrant's Crisis Continuum department that focuses on mobile crisis teams. So today, what I wanted to do, if we can go to the next slide, is talk about mobile crisis and 988 connections. So first off, though, a disclaimer from SAMHSA, you can keep on this slide, but first the disclaimer from SAMHSA and CMS that they are they are a funder, but the content of the presentation today is not representative of SAMHSA. So we'll go through a synopsis of an event that we had in December, which was the 988 Contact Center and Mobile Crisis Teams Connection Summit. We'll review some data that I collected from an initial feedback survey and a 3-month post-event feedback survey, and then discussing some action steps and upcoming initiatives. I'm really somebody that likes to have that practical application of knowledge, right? Like, here's what happened, but now what do we do with it, right? So we can go to the next one. So our 988 Contact Center and MCT Connection Summit, which from here on out, I'll probably just refer to as the summit because it's a pretty long title, was a collaborative effort between SAMHSA and Vibrant, and we held it in December last year. What was really amazing was we had 75 participants, and it was an in-person 2-day summit that represented 35 states and 2 territories. So we had just a vast representation of geographic regions during this event. And it was so cool to be able to see all the different perspectives that we got. So we had 37 attendees that came from 988 Lifeline centers, 13 from local mobile crisis teams, co-response teams, community response teams, and other types of crisis response. And also, as I go through, if I'm saying mobile crisis teams, I'm referring to everyone that's under that umbrella, including our co-responders as well. And then, a handful of folks from Vibrant and SAMHSA. Oops, if we could go back still. A handful of folks from Vibrant and SAMHSA, some national partners, community organizations, but really emphasizing the need, right, to have diverse voices and perspectives in the room. So we had individuals from the deaf and hard of hearing community that were representing LGBTQ and BIPOC communities, as well as different kind of agency types and population sizes, and like the length of time that they'd all been running as the team or as an organization. We can go to the next one. So with this summit, the main purpose was to bring people together, right? We have all had that, opportunity with COVID to be in virtual spaces, but it's really nice to be able to get together and do the work in person. So bringing lots of different perspectives and experiences across the states and the territories to have those in-depth conversations to see what can we do to really strengthen, fortify, build those relationships between 988 and mobile crisis teams. So we had 3 objectives that we went through during this summit, which were mutual learning, envisioning ways that we can enhance the 988 and mobile crisis team connections process, and then analyzing and identifying really creative implementation strategies for that collaborative work towards mutual outcomes. It's so important, right, that we're working together in this crisis continuum space, that, working together and having these conversations on what can we do to make it even better. It was a jam-packed agenda, let me tell you. So first, we had presentations by SAMHSA. These presentations included their nationwide vision for the crisis continuum, how 988 and mobile crisis fit into that, discussions on grant cohorts and CCRPs, and the amazing, funding opportunities that are happening for CCBHCs, really expanding, access to all across the nation. And then we also had presentations by Dr. Goldman and Preston Looper on that national survey of mobile crisis teams that Preston was just kind of discussing, as we saw on the dashboard. We had 2 speaker panels. Those panels were set up so that we had one that was composed of those larger agencies, longstanding teams. They've been doing this for a long time. Maybe they have multiple levels of the crisis continuum within one agency. Our co-responders, some of our state leads. And then we had a different panel that was really more focused on kind of diverse identities and areas. So we talked about rural mobile crisis teams, mobile crisis with tribal communities and in the territories, and with other minoritized populations, some of those smaller teams, as well as I think university mobile crisis teams, which I don't think is one that we consider as often, right? So those really kind of focused on that first objective of the mutual learning, right? We're going to hear from what's going on all over the country and kind of get those sparks flying to see, is this something that I could do in my community? Am I doing something that's aligned? What's possible here, right? Dreaming real big. Then we did a case study activity as well. And in that case study activity, everybody received kind of just a simple generic, somebody's contacting you for help, but we wanted to make sure it was generic so that it could apply to anybody, whether you're a state lead or a co-response team or a 988 center, that you could really kind of problem solve through it. And everyone in breakout groups work together with their teams to develop like a triage and dispatch process, right? So a decision tree matrix of sorts. What are some of the next questions that you could ask of this individual that's asking for help to decide what they need? Do they need a mobile crisis team? Are they okay on the phone? Or is there something, an element to it that maybe we need to have a escalated response, for some of those first responders? Also discussing, what's the difference between sending a CIT officer, a co-response team, a mobile crisis team? Are there different, elements to a situation that would really kind of ping in your brain that you need to go from one team to the other team? And, what's just going to be the best, least restrictive response for this person that needs help? And we had a great big discussion on why everyone chose, the avenues that they went through. And then that third day, we had really rich, robust, in-depth conversations that had to do with cross-discipline collaboration and partnerships, right? How, as a 988 center, can I contact and work with a mobile crisis team? How do I even get those formal relationships started? As a, police officer, what are some ways that I can best, engage with my community and with my 988 center, right? So kind of doing that multidisciplinary back and forth, discussions to make sure that we really are collaborating together. Had talks on diverse needs and populations with crisis systems. So, how do we retain staff that are representative of the individuals that we are serving? How can we best, build rapport with individuals who are from minoritized communities or, other identities that may have historically had some harm by some of these systems done? Like, what can we do together to make sure that the individuals who need it the most, no matter how they identify, are able to get the services that they need when they need them? And then always the question that we are always discussing, right, is that staffing and workforce challenges. So having some dialogue around that as well. So with the summit, the very last day, a survey was distributed to everyone, and we got a really great response rate. We had 39 responses, which was about 70% of the individuals that we expected to be able to respond out of all attendees. And so some of those initial results really showcased the impact of the summit just initially, right? Just right out from the start, while everything was fresh in people's minds. So we could see that both the purpose and the objectives were met. Individuals noted about 97% of the time that they either agreed or strongly agreed that the objectives and the purpose were met. So that was great to see as well. Really, really meant something. Then the next one, on the left side here is continuation of the initial survey. And then on the right side is data from the follow-up survey. So initially, as you know, right as the event ended, about, I think, 95% of individuals that attended either agreed or strongly agreed that the summit was applicable to efforts at their agency, right? So it really was something that they felt like they could bring back to their work, and it really applied. And then 85% of individuals felt that they strongly agreed that participating in the summit really did help kind of clear up or strengthen, get some ideas going around the connections between 988 and mobile crisis. So maybe if you're a 988 center, you felt more confident in being able to work with local mobile crisis teams, or the other way around. Then we wanted to really make sure to see how the momentum, was going, and, did the summit have, a lasting impact, right? Because I know, when we go to conferences and we're just so pumped and jazzed and excited, right? As soon as it's over, you're like, oh, I got all these ideas. Like, I learned all these new things. I'm going to do this, I'm going to do that. But as we got a little bit further away, did it still make sense? Was it useful? Was it beneficial? And so 91% of individuals that responded to this survey felt that attending the summit did make a positive impact in their work. And some of the ways that people identified making that positive impact, we had about 22 and 23 each. So also a note that for this chart on the bottom, individuals that responded to the survey could choose more than one category. So that's why the numbers are a little bit bigger than just 33, but people felt that they were able to take a new approach to the services that they provide, and they researched other programs. Those were the top two, but then we also had those that responded that they were continuing those connections. Really at the summit, we saw a huge opportunity for networking, and lots of people stayed after to kind of talk to each other and meet up. And so that continued, via email or in other settings, right? To be able to have those conversations. Hey, I heard you, are doing this in your team. I'm trying to implement this. Like, what do you think? And, being able to go about it that way. So then a handful of people also were starting new programs. They were addressing diversity and equity in different ways in their programs. They gained a new perspective, and one person identified that the summit didn't really have much of an impact on the work they were doing. Next one. And I always like to see quotes. I like qualitative data. Numbers are great, but when you can really hear from the people that were there, how they expressed themselves and what it really meant to them, I think that has an even greater impact in the work that we're doing. So people felt that it was incredibly validating. It was a wonderful experience. And they gained a better understanding of what the crisis continuum is. I think one of my favorite ones was that we're all working hard to do the same thing, which is respond quickly and compassionately to those in crisis. And I also like the one that mobile crisis in the remote state could be possible, right? So coming to this event, they felt that like maybe they'd felt a little bit lost or unsure of what the landscape could look like in their state, but they saw, that it's possible in rural and remote areas. And so that gave, some confidence boost. But that's really what we're doing, right? We're working to make crisis services accessible and available and relevant to anyone, no matter where you are. Next one, please. So what do we do with all of this information, right? We have a summit, we have an event, we take a survey, we do all of these things. And now what, right? So we had a lot of different elements of feedback, but I think some of the ones to highlight the most is that we completed an executive summary based on all of the findings and the outcomes from the Mobile Crisis Summit. And so that'll get dropped in the chat for y'all if you're interested in reading it. And then we're working on a manuscript to be published in an academic journal that's a little bit of an expanded information based on that kind of executive summary and the summit's outcomes. So we want to make sure that this information is widely available to individuals that need it. You know, we really need a boost in the literature on mobile crisis teams. And then through Vibrance Crisis Continuum, we're working right now on developing a webinar series, a working group series, and some guidance documents, and having that continued technical assistance for our 988 centers as they're working, you know, with the local mobile crisis teams. So we'll keep y'all updated once we get those webinars set up. They should be coming fairly soon. I'm really excited. We got a couple really great topics. So as we're getting to that, we'll make sure that y'all have access to that information. And then the last slide is the contact information. So if you have any questions, if you have any, you know, thing that you need help problem solving with between 988 and mobile crisis teams, we're happy to answer questions in that the general crisis continuum email. Thanks all so much.
Great. Well, thank you so much, Jess. I'm going to bring in Preston Looper back to the conversation to just react to that presentation. There was a lot of information, and I know I'm looking forward to what's coming next as far as that webinar series. But Preston, what's your reaction here?
Very cool. Thanks, Jess. Very beautiful. I'll tell you, I was there, and the experience was very potent. And what was most potent for me from that experience was I'm not alone. You know, a lot of mobile crisis providers have been toiling away, frequently in isolation, and there's not a professional home, if you will, for mobile crisis. And I'm not alone. And there's incredible diversity. And, there's other people doing the work and different perspectives. And then finally, just a lot of excitement. As well as some anxiety and trepidation around what's expected from the nation and the community and the 988 centers in terms of the volumes that are necessary. And then finally, as it relates to that for mobile crisis, scale matters. And a lot of the mobile crisis teams are really struggling around achieving scale. And so I think that's a big driver of their anxiety.
Yeah, that's really important, Preston. I think anytime there is questions around certainty or continuity, that does create anxiety. Amanda, I'd like to bring you back in and get your take. And I know you work so closely with Jess here within Vibrant, but kind of add a little color for us.
Thank you, Laura. Good job, Jess. So when I reflect back on the MCT summit, post-convening, and I think it's still true today, if I could identify one word about the summit, it is connectedness. It was incredible to be in a shared space with our SAMHSA reps, our folks from Vibrant and 988 contact centers, just being in space together under the same roof. The 2-day summit was truly a monumental and moving space to be able to share amongst our 36 states and 2 territories, and hearing all about the work that is happening amongst those states and territories, the good, the bad, the ugly, areas of opportunity. And so it was fulfilling with a lot of blood, sweat, and tears, dreaming about the summit for a while, to really hear that overwhelming positive feedback that we received, post-convening, and also our 3-month survey that was sent out to our participants as well. And hearing the request of our attendees around additional webinars, working groups, implementing guidance documents to truly really deepen the interface of 988 and mobile crisis. And so the summit was really just the beginning of the momentum that we are, actively working on right now. As Jess stated, is working on a draft to come up with webinar topics that will increase that interface, our working groups, guidance documents. And so I still, to this day, beam over the MCT summit. It was incredible.
Awesome. Thank you, Jess. I'm just checking the chat. Looks like you have some great feedback here. Just wanted to thank you for this presentation. Yes, and I think everyone's really excited to see those survey results. So I just want to thank you, Jess, for your presentation. Thank you, Preston, for sharing more about that dashboard, and Amanda for your thoughts as well. So now I'm going to turn it to another friend of the jam, Tiffany Russell. Can you give us a SAMHSA update?
Hi, Laura. Thank you so much. I appreciate that. Happy to be here today to give and provide our updates for SAMHSA. Want to start off with a reminder that comments are due on June 28th of this month, and reply comments are due on July 29th for the Federal Communications Commission's, or the FCC, proposal that requires wireless carriers to implement one or more geo-routing solutions for calls to the 988 Lifeline. And I can drop the link in the chat for that as well. But I'm also really excited to share about the upcoming episode for Connecting to Serve, which is our Promising Practices for 988 and 911 collaboration webinar series. And so on June 27th at 1 p.m. Eastern Standard Time, which is also our 5th session, we will be talking about risk and liability. So I know that this is one of the main topics that we always get questions about. It's one of the things that always comes up when we're talking about 988, 911 interoperability. And so we really wanted to take our time to make sure that we were able to provide information and bring on panelists and experts that could really talk about this in a very meaningful way. And so this 5th episode for this series will really review some of the crucial concepts pertaining to the foundations of risk and liability, also establishing some standard operating definitions for when we're talking about risk and liability, also about qualified immunity. And in addition, this webinar will also offer some perspectives from law enforcement and governing entities, and really just have a high level overview to kind of like assist in building some of the common understandings around those critical components in order to establish a framework for further discussion. The other great thing is that this is also going to be a 2-part series. And so that first episode will be setting the foundation to have that conversation around risk and liability. And then the second episode, which will take place on July 25th, at 1 p.m. Eastern Standard Time, will then offer examples of how community leaders, public safety officials, as well as legal counsel can work together to establish policies and procedures that really foster collaboration and also provides opportunities for interoperability amongst 988 and 911. For both of these sessions, they're going to be back to back because typically this webinar series is every other month or bi-monthly, but we wanted to keep them close because they are a 2-part series. And so for both of these sessions, we will not only have our technical assistance providers online to offer office hours at the end of each session after question and answer, but they will also be there to offer opportunities for one-on-one calls if you still need more assistance, if you still have more questions and need more help, where we can connect you with our technical assistance providers. And so I will drop the registration link in the chat for this as well, but we're super excited that we finally have this topic coming up on our Connecting to Serve series. We've had some great participation over the course of this 6 series episode. And so we're really excited to finally get to a topic that I know everyone is really interested in hearing more about. So we encourage you to spread the word. If you know of anyone who has had a lot of questions about risk and liability as it pertains to 911 and 988, please share this information with them. We're really excited and looking forward to this 2-part series coming up. Thanks, Laura.
Thanks, Stephanie. Appreciate that update. And I know folks are eager to see more come out of SAMHSA. So just thank you for sharing that. Now we're going to move to our NASH bid update, and I'm going to bring in Carrie Slatton-Hodges to share that with us. Carrie?
Yes, it's such an exciting time right now. As many of you may have heard, Yesterday, we had the announcement of the 10 new CCBHC demonstration participants. So the U.S. Department of Health and Human Services, through CMS, in partnership with SAMHSA, welcomed 10 new states into the Medicaid demonstration program. Now, these states had been in a planning program prior to this, and they successfully developed the necessary infrastructure within their state, and they worked with providers in their states to develop the programs to meet CCBHC standards. And so we are welcoming Alabama, Illinois, Indiana, Iowa, Kansas, Maine, New Hampshire, New Mexico, Rhode Island, and Vermont. So it's a really exciting time. As most of you know, the CCBHC programs have just been a huge boost to behavioral health services across our nation, both from an access perspective, because the number of persons being served because of CCBHCs has gone up dramatically, and also in terms of supporting the work across our crisis system in our state. The CCBHC model allows a different type of funding to support the work that we are doing, both in preventing crisis and addressing crisis. And that the full cost of providing this care and treatment 24/7 can go into a cost report, which is then what is the basis for how these services are paid. Now, this was happened due to the Bipartisan Safety Communities Act that was signed into law by President Biden, and it gave HHS the authority to add 10 new states to the demonstration every 2 years. So this is the first time that we've seen the add of 10 new states. And they joined the 8 states that have currently been in the Medicaid demonstration program. Those 8 states are Michigan, Missouri, Kentucky, Nevada, New Jersey, New York, Oklahoma, and Oregon. So that brings us up to 18 states now that will be participating in the CCBHC demonstration. It's very exciting as we continue to see this grow across our nation and the work that it does. And, you know, CCBHCs must ensure access to a comprehensive range of services, providing care coordination when needed, and incorporating evidence-based practices and other supports based upon a community needs assessment that are done within their community. And this includes crisis services that are available 24 hours a day and 7 days a week. So it's a very exciting time. Congratulations to those 10 states. And we look forward to providing all the support you need to be as successful as possible. Thank you.
Awesome. Thank you, Carrie. Great to hear that come out of HHS yesterday. Okay, so now we're at the tech corner. David, do you want to share with us what's going on the tech side?
Yeah, excited to be back here as always. And as we hear more and more about AI just in general, we want to be providing some tools and some pointers about how we can think about being potentially informed AI consumers within the crisis care world. And today we're going to hit on a really key topic, which is what are elements as well as good questions that we can ask to ascertain AI quality. Next slide, please. And I'm going to make a little analogy. Hopefully this will be useful. But with a little bit of training, anybody can learn how to accurately measure a piece of wood with a tape measure. Next, please. But if the task is measuring a highway, and let me draw the parallel here that with any individual 988 call, we could figure out whether there was a quality suicide risk assessment done. But with millions of calls and contacts coming to 988, it's really not possible for us to use that tape measure of the traditional methods. And so the hope is that AI might be able to tackle that large scale task. Next, please. Yeah, and so the question is, when can we trust that AI? And so today we're going to hit on 3 foundational qualities. Is that AI valid, accurate, and unbiased? And these 3 points show up in all of the proposed regulatory frameworks in one way, shape, or flavor. Next slide, please. So many times, and actually just click out, there's a couple points here, just perfect. In many instances, what we want from AI is for it to do exactly what we just talked about, to replicate and massively scale up expert human judgment. And so the first key question is, well, what is that expert human judgment that the AI is being trained on? Is it accurate? Like in this example, the tape measure is not very accurate. Those numbers are not as they should be. And the best answer here is that we know a lot from research and previous work on how to on clinically validated evaluation and assessment tools. Within the crisis world, we'd be thinking about the work of Dr. Madeline Gould and colleagues. So that really would be the best answer, is that we're training the AI on a validated, high-quality clinical tool. Other responses we could hear is that there's a team of experts that we've trained it on, which sounds good, but is awfully vague. And ChatGPT could do this, but we just wouldn't have any validity data about whether it's doing it well. Next slide, please. The second is, how accurate are the AI models? And one of the themes through all of the regulatory language that's being proposed is this idea of transparency. And so a key point of transparency is around the data that were used to create models. So some key questions that we'd want to ask is, how much data was included? What is the accuracy of the models on hopefully test data, that is data that's separate from the data that was used to train the models? And really the best answer, if you will, is that there are published results. Then we can rely on that there has at least been the peer-reviewed scientific publication process to question and to provide some validation for the AI models. And next, please. Third, the reality is that we could have a valid assessment tool that it's based on. We could have lots of training data, and we could still have bias. And this is perhaps one of the biggest threats for AI, which is that we replicate bias at scale. And we're seeing it here with our 2 little robots, that if all of the training data looks alike, then it may not be a good generalization to different populations in different settings that have very diverse call takers and callers, as one example. Next, please. And so the opening question is, how diverse and how representative is the training data? And as a potential consumer, does it reflect, is it a good representation of my setting and my population? And again, the best answer here is that there has been systematic scrutiny of the AI models across things like diverse call takers and diverse callers, settings and populations. And so there's some actual results and some knowledge that we can review. Next slide, please. So this has been a bit of a whirlwind tour. I'm trying to really just kind of spread some breadcrumbs here. Happy to follow up with anyone who wants more information here. And from here, as we've been talking about how to identify quality in AI models, next month we will hit generative AI, ChatGPT and its cousins, and what we might want to know about. Thank you so much.
Thank you, Dave. I think there were a lot of considerations in there, lots of great questions. And I love that you pointed out the bias piece because that certainly exists, and we want to make sure that we're accounting for that. So thank you. Yeah, we'll have to dive deeper a little bit more there. But I do want to take us to our next segment, which is our crisis talk article. This is one from the vault. And so I'll turn it over to you, Stephanie, to walk us through it.
Thanks, Laura. So I'd like to welcome Johnny Gasper. He's the Director of Justice and Crisis Systems at Arizona Complete Health. Johnny, when we spoke in 2021, you discussed the shift from physical to virtual co-location because of COVID at Tucson's 911 call center. And when I say that, I mean specifically behavioral health crisis professionals. You're expanding co-location to other counties with both an in-person and also a virtual component. And yesterday you shared with me that both are needed. Can you explain why that is?
Yeah, thank you so much for having me today. Happy to be here. So yeah, what we've seen historically and as well in the expansion is that having folks co-located physically to develop relationships with 911 communication PSAP staff, right? So the folks that maybe aren't as familiar with the crisis system, don't quite understand the resources available, and just developing an overall comfort with utilizing the system, right? Those folks in the PSAP historically have handled these calls all internally. So telling them now moving forward that they have an additional resource that they can trust, but maybe aren't familiar with, has always been one of the difficulties or hurdles that we've tried to tackle when trying to roll out this expansion effort. What we see when we have folks co-located is the ability to staff cases, the ability to work on calls together, develop a positive relationship, and really understand a piece of the system, that being more so the telephonic aspect of it, and understand how that links into mobile crisis as well as into the observation units after they've transported. So looking at kind of how it's structured presently, during peak volume times in Tucson, as well as what we'll see in our more rural communities where we're expanding, you will have physically co-located staff. The benefit of having that link as well into kind of a virtual environment that might have virtual CAD, which is computer aided dispatch access, is that those folks, when they are on calls, or if they're busy during peak hours, if we have 2-3 staff and 4 calls come in, there still is the ability to transfer to a dedicated line that will give you to a specialist that is, one, familiar with this partnership, that understands the nexus of 911, as well as the unique pieces of these calls when they come in, right? We activate for these calls at a much higher rate. Oftentimes folks want in-person intervention regardless of what their presentation is during that inbound call. So the knowledge of that when we transfer these calls has been largely a benefit in our success. And in addition to that, right, when those call takers aren't there, if we're covering, 120 hours a week, obviously that's not 24/7 through a physical co-location. The ability then to say, hey, you'll get the same level of service just without those folks here by transferring to the same line, allows us to say that we still are here to support you, right? The same processes are in place, different workers that we have put through the system, ensured that have been trained in the PSAPs or the CAD systems. So there is still some familiarity there. They still know the folks that are taking these calls because they're skilled to take these calls as priority. However, we can take a larger volume of calls. We understand that someone's always going to be there to answer. And in addition to that, again, kind of looping it back, having someone physically there during those peak hours ensures that we can develop a partnership and relationship that can produce this level of success and continue to develop more transferred calls for us.
And when you say with the callers coming into 911, is there a higher percentage when it's coming through 911 that want an in-person response? Is that okay?
Yeah, that's very accurate. And I relate this to kind of your personal experience, right? If I'm an offender bender and I dial 911 and they tell me I can file a claim online, I think oftentimes maybe I feel a little upset, right? So I think it's similar to that. Folks calling into 911 enjoy and expect that there's going to be an intervention. Someone's going to come out and talk to me physically. So comparatively, we activate. So we send mobile teams for those 911 transferred calls over 60% of the time. It hovers around 65%. And that, in contrast, right, from general callers when I'm calling into 988 or dedicated crisis line numbers, regional crisis line numbers, we're activating at a rate of 30 to 40%. So it really is truly like the opposite. So we do expect that from these calls, and we understand that that's a need for the community as well.
And you mentioned in the article how it gives access for folks who are in more remote areas to be able to have individuals who can answer the calls, but also be hooked into the CAD system. Can you just talk very briefly about what that looks like for remote communities?
Yeah, so I think that this is a nice time to kind of segue into kind of where we're expanding now. The rural focus of this, particularly since when we looked at the new the callers coming in through the 911 system, we saw an increasing number of folks that hadn't touched the 988 or crisis line system historically. So the benefit of this, right, in rural communities is there is more of a general familiarity with utilizing 911 and expecting that face-to-face response. So we know that there are new people that our system hasn't touched that we can outreach and get through this program as well and ensure that we're providing some additional services. That's led to co-locations on tribal nations. So I'll share in Northern Arizona, one of the tribal nations that we seek to support through a partnership with Coconino County is a tribal community that historically has accessed the system through 911 and emergency departments, right? And obviously, some of that is relational in the sense that when I'm dialing 911, if fire and EMS are coming out, there's a strong likelihood that I'm going to end up in an emergency department, even if my presentation is linked to anxiety or a panic attack, right? So the ability to partner there early on in the intervention and ensure that we don't have to send out, fire or EMS and actually send out a team in those more rural environments generates a huge improvement for us on system.
Thank you so much for joining me, Johnny. I'll pass it back to you, Laura.
Thank you, Stephanie. Again, another really fascinating conversation. And I actually just wanted to pick up on a thread here, Preston, that you had talked about earlier. And I know there's been a lot of interest back in this dashboard. So if you don't mind, could we go back to that? And if you wouldn't mind kind of helping us walk through what we're looking at here, I wanted to spend a little bit more time on this one because I just thought this was really fascinating.
Yeah, right on. So we looked at this for the survey respondents. We asked a number of questions, and we tried to identify a subset of all the available, what people might consider best practices. And this is both administrative and clinically. So, does your mobile crisis operations serve all persons regardless of insurance? So we got a 90% rate of that. Is there a non-law enforcement voluntary transport option available with mobile crisis? So we got 81%. Are we seeing 2 of 3 of the suicide prevention best practices in terms of universal screening, using a standardized tool, lethal means restriction, safety planning, 2-person teams? And you'll see as they start to begin to decrease, Medicaid billing, 60%, coordination with crisis facilities. And that gets to the issue, that coordination, integration, if you will, with 988 crisis lines, with receiving facilities sort of across the system, coordination with outpatient services, 24/7 operation with greater than 11 FTEs. So 70% of the mobile crisis teams told us that they were operating 24/7. However, when we looked at really the minimum bandwidth clinical staff, not administrative, to be able to schedule 24/7, we saw that only 40% met both of those criteria. And that gets to that issue that I was talking about in terms of scale matters. There's a lot of small teams, sometimes trying to put stuff together with duct tape and baling wire, if you will. Inclusion of peer specialists, and then integration with 988. So that notion of sort of a formal relationship with the crisis hotline, that's 988. And that's a big issue. This notion of dispatch seems really simple. It's complicated in a number of ways. And I think people across the nation are looking for a framework that would, create standardization, but also allow for, responsivity to the local context.
Yeah, that's really fascinating, Preston. I do want to, if anyone wants to jump into the conversation, feel free to do the raised hand reaction so that we can bring you into the conversation. But Preston, as you're seeing these regions that are kind of, I think most folks are serving people without insurance, but as they're trying to build these out, what do you see are some of the barriers and where do you see the opportunity?
Well, I think an opportunity, and is, I'll get to it, sort of scale and funding. So not only do we need to look at a variety of provider types that can provide mobile crisis services, it's, getting to above that sort of minimum threshold of 11 FTEs, from my perspective, to maintain a workforce. A lot of people want to do this cool work, but if you can't get off, if you've experienced tremendous guilt because you're taken off or have routine leave and can't make that happen, that makes these really challenging. And so I think the greatest opportunity is to look at structure and funding so that these operations can create jobs worth having for lives worth living.
Awesome. Thank you, Preston. What a good way for us to wrap this up. Scale and funding. Very important, as this week we have another state issuing or creating a sustainable funding mechanism for 988. So come back to us next week for acceptance of crisis services by marginalized populations. We'll have Dr. Brian Sims, who we had earlier in the show today, join us. Now, remember, we have some holidays coming up. So June 19th is Juneteenth, a newer federal holiday. There will be no Crisis Jam that day. And then the following week, because of the Crisis Now 3 Summit, which is international, I think it's in Amsterdam. We will not have one on the June 26th date either. So next week, and then a break, and we'll be back July 3rd for the holiday. All right. Thank you, everyone, for joining us.